Every physical assessment begins with a structured, respectful, and holistic approach, CRANE, from the head to the toes.
Physical examination is the logical and systematic examination of human body. This logical assessment involves the use of different modalities and human five senses with the aim of finding abnormalities in that body part. Assessment of patient's body is a painstaking procedure, i.e., it is a procedure that requires much observation and carefulness. According to findings from research, when physical examination and history taking is carefully carried out, up to 70% of diagnosis is provided, while the remaining 30% is provided from laboratory and radiological investigations.
We carry out a physical examination of patients to understand not just what the patient feels, but what the body is saying. Physical examination is carried out following the sequence of IPPA: inspection, palpation, percussion, and auscultation.
Physical examination is carried out following the sequence of IPPA: inspection, which means using the eyes to look for; palpation, which means using the hand to feel for; percussion, which using the hand to tap; and auscultation, which means using the stethoscope to listen. These techniques and methods are used carefully following the cephalocaudal approach, which also means assessing the patient from the head to toes. Things you should know before performing any physical examination on patient. Before performing any procedure, it is important to receive consent from the patient. Ask for permission to make an examination. Explain what you intend to do before touching the person and doing it, especially the blind. Ask the patient if he/she has questions and always answer them. Check if the patient has understood your intentions, etc. Obtain informed consent before proceeding. Informed consent means that the patient and the patient's family understands what is to take place, including the potential risk and complications of both proceeding and not proceeding, and have given permission for a course of action. Ensure that the examination couch is covered with a drape or sheet so as to increase warmth. Ensure there is adequate light, either natural or artificial source. Some positions during physical assessment is usually embarrassing and uncomfortable to patients, therefore should not be maintained for too long. Be attentive to legal, religious, cultural, linguistic, and family norms and difference. Your duty is to care for patient and not to judge. If you are asked to care for someone who is alleged to have committed a crime, it is not your responsibility to administer justice. You are to provide care to all, regardless of social status or any other consideration. By acting in this way, you will be seen to be fair and equitable by the community you serve. NB. When examining a patient on bed or couch, always stand at the right side of the patient. Standing on the right side of patient decreases movement around patient. Secondly, it gives patient a feeling of control over the situation. Inspection is the careful observation of a patient using the sense of sight and sometimes smell to identify abnormalities. It is the first step in physical examination and provides crucial clues about the patient's health. Inspection should always be systematic, meaning you examine the body in a planned, organized manner rather than randomly. It involves looking for visible or olfactory signs of disease or abnormality. What to observe? During inspection, pay attention to features such as discharge from any body orifices, masses or unusual lumps, abnormal movements or tremors, moisture or dryness of the skin, color changes, pallor, jaundice, cyanosis, shape and symmetry of body parts, growths or lesions, odors, e.g. fruity smell in diabetic ketoacidosis, halitosis. Helpful acronym DOS. Use DOS as a quick guide during inspection. D. Deformity or discharge. O. Open wounds. S. Swelling or smelling. Palpation. Palpation involves the examination of the body using the digits of hand to detect abnormalities such as induration, also known as hardness, excessive warmth, tenderness, that is, a pain felt on touching patient body parts, masses, crepitus, and inflammation, etc. Percussion. Percussion is the process of using hands to tap hollow organs to elicit abnormal and normal sounds or vibration produced by body organs such as lungs and abdomen, which may assist in making diagnosis of a disease. The main aim of percussing body region such as chest and abdomen is to determine if the area under the percussed finger is air-filled. Normally, air-filled organs produces resonant sound like a drum. While fluid fills an organ, it produces a dull sound. Also, when solid masses fills an organ, a flat sound is produced. The sound produced could be an indication of one disease or the other. Auscultation is the use of sound amplifying instruments such as stethoscopes to listen to sounds produced by different organs of the body during normal activity of the organ. Head and neck region. The patient should be in a sitting position if not contraindicated by her condition. The examiner should inspect the patient's head for presence of lice, dandruff, ectoparasite infestation, ringworm, scars from healed injuries, fresh wound. Palpation. Palpate the scalp to check for tenderness, induration, masses, swelling, bumps, growths, and scalp pains which may be present in wound, boils, and in parasitic lice infestation.
We begin by gently pulling down the lower eyelid to inspect the conjunctiva for pallor or signs of inflammation.
The eyes. Inspect the eyes for abnormalities by comparing one eye with the other. This procedure can easily reveal unilateral disease of the eye, that is, a disease affecting one eye. Inspect the eye for entropion and blepharitis, also known as inflammation of eyelids. Proceed to inspect the margin of the eyelids for mucus or pus discharge, which may be an indicator of allergic or infectious eye infection. Also check for scales and examine the conjunctiva for jaundice and pallor by pulling down the lower lid gently and asking patient to look upward. Then proceed to evert the upper lid to examine for other abnormalities. NB. Reddened sclera may indicate marijuana use or rheumatoid disease. Observe the lacrimal apparatus for excess dryness or tearing. Use the pen touch to examine the cornea for growths or follicles of xerophthalmia, vitamin A deficiency. Use the pen light, flash it on the pupil to check for pupillary reaction. Also check the color of the cornea, which is supposed to be lustrous and crystal clear.
I'm inspecting the nose frontally and laterally for symmetry. Now, gently palpating the bony and cartilage.
Nose examination in physical assessment. Step 1. Inspection. Begin by examining the nose both frontally and laterally. During inspection, look carefully for shape and contour, humps, unusual length, drooping tip, or depression of the nasal bridge. Symmetry. Check for nasal septum deviation from a straight central line. Nostrils, size, symmetry, or any distortion. Surface changes, scars, pits, growths, or discoloration. Skin changes, excoriations, or redness. Tip for teaching. Hold the patient's head steady and observe from multiple angles, front, side, and slightly above to ensure nothing is missed. Step 2. Palpation. Gently palpate the bony and cartilaginous junctions of the nose. Check for induration, swelling, or tenderness. To examine for polyps or other nasal blockages, gently push the nose upward using your thumb while observing the patient's response. Oral cavity. As the patient speaks to you, observe the patient for halitosis and ability to open and close mouth, noting for difficulty. If there is difficulty, it could mean TM joint dislocation. Proceed to inspect the teeth for dental caries, cavities, then proceed to check for pyorrhea, plaque, periodontal pockets, and periapical abscesses in the gum. Check for extra teeth. Use the tongue depressor to observe the color of the tongue. Check for presence of white patches on the tongue. Note, a smooth, often sore tongue without papillae suggests vitamin B deficiency. Inspect for perforation or fistula and color of the gum. Palpation. Use gloved thumb and index finger to palpate the gum for tenderness, bleeding, and exotosis. Examine temporomandibular joint for malocclusion and pain.
We begin with a systematic inspection of the external ear, checking for deformities. Then,
Inspect the external ear for nodules, growth such as polyps, serious injuries, surgical scars, wound, cysts, crusting, and fistula. Check for anomalies associated with the shape and size of the ear. Use the otoscope, examine the inner ear for redness, wax impaction, deformities, intactness of the eardrum, presence of hairs, and check for perforation of the eardrum. Palpate. Palpate to check for swelling of the external ear structures, perform tragus sign, and then pull the pinna firmly in all directions to check for tenderness. Then, in advanced case, refer for audiometry.